the Funding and Executive Director of Information Training and Outreach Center for African Librarians. Welcome, Doc. Hello. Hello, Dr. Mwanza.
No, we may have lost him. There he is.
No,
Grayson,
we cannot hear you, Grayson.
yeah, it's not clear. Okay. We're over 50 people signed in already. So this is very successful. We have a lot of work to do, though.
Yeah.
Okay, we'll give Grayson one more chance to log in and see if he does better. And if not, we shall start.
Yeah, I see Dr. Mwanza's network is acting up. Maybe we can wait for a minute or two for him.
Okay.
Morning. Doc Ryan, can you give us welcome remarks, if possible?
Oh, sure. Okay, we're just very pleased that all of you were notified about this workshop and that we are holding it in the country of Zimbabwe. We realize that over the years, many people have come and gone from positions, and we need to train a new group of librarians.
Can you hear me now?
Yes, so go ahead. Okay. Okay. Shall I continue? We just want to welcome you all to the meeting, and we don't have a connection with our colleague Grayson, who is the chair of the Executive Council of Research for Life and has been working on this program since, I think, 2002. So we will proceed. We have Petronella, do you want to introduce the two trainers, or should we introduce ourselves? And then we'll get on to the first presentation so we can start training people. Well, my first thing is, though, I have to say to Petronella, this woman had the initiative to communicate with a colleague of ours, and it is her initiative that set up this training for your country. So we have to thank her for her willingness and creativity to communicate with people she didn't know and get this set up. So now you can introduce the two of us if you'd like.
All right, colleagues, Let's welcome Dr. Ryan, Senior Training Advisor, Research for Life Country Connector project and Research for Life trainer since 2006. We also have Ms. Jen. She is the Technical Assistant Library Systems and Dissemination. She's also Science Information and Dissemination, World Health Organization Regional Officer for Eastern Mediterranean. They are the ones who will be training us today on Research for Life. Let's all welcome them.
Okay. And the first presenter will be Jahan because I'm actually in Florida and it is now a few minutes after 6 o'clock in the morning. So she will do the first session, so I have time to wake up and get organized. Please go ahead with the opening Research for Life overview.
Thank you very much. Thank you, Nini. Thank you, Petronella. I would like just to add a little thing in addition to what Petronella just said, that I am the co-chair as well for the subcommittee, the Capacity Development Subcommittee for Research.
Can you still hear me, Lenny?
Now we can.
Are we waiting for Gratian?
I think at this point we should go ahead. Do you agree?
Gratian,
Well,
are you here?
I
We lost
can hear both of you. If you... Yes, I can hear you. Can you hear me?
No, we cannot hear you, Gratian.
Research for Life.
Okay. I think we lost him again, so I think you should go ahead and start.
Okay, I will start.
Okay.
Colleagues and participants, good afternoon. I think we are almost at the same time zone. Here in Egypt, I am at noon. It's 1 o'clock here and it's noon at your end. So it's approximately the same time zone. I will start with a briefing or a little briefing about Research for Life. We will talk about an introduction and what is Research for Life. Research for Life Partnership, the 5 collections of Research for Life, the eligibility criteria to register for Research for Life, what are Group A and Group B for country categories, the agreement and terms of use for Research for Life, registration for the 5 collection, and how to access the 5 collections for Research for Life. Actually, Research for Life is a public-private partnership for 5 UN agencies, which are FAO, WHO, UNEP, WIPO, ILO, Cornell University, along with Yale University. I would like just a second to start my stopwatch for the timing, please. Okay. That's it. Participants, can you please mute yourself? Along with the International Association of Scientific, Technical, and Medical Publishers and up to 200 international scientific publishers. The main goal for Research for Life is to reduce the knowledge gap between high and low and middle income countries by providing an amazing collection and affordable access to high quality scientific research. And since 2002, Research for Life provided researchers from more than 11,000 institutions in more than 125 low and middle income countries with free or low cost online access to an amazing collection. Petronella, can you please mute the participants? Thank you so much. To an amazing collection and a very wide variety of collection from electronic resources, from books, e-journals, databases, and other in the 5 disciplines of the 5 collection, from health to agriculture, environment, applied science, and global justice as well. The main aim or the main goal for Research for Life is to give access to a wide range of scientific literature that is out of reach of universities, researchers, schools, students in these low and middle income countries. And the initiative was to create and reduce the knowledge gap between high income countries and low and middle income countries. As you may notice that I emphasized that Research for Life is to give the access and help researcher institutes, universities in low and middle income countries due to the knowledge gap. We should know why this knowledge gap have been created. This knowledge gap have been created due to the high cost of subscription for scientific literature that has long been unaffordable for these universities, students, researchers, organizations in the low and middle income countries. I will give you an example with, for example, the Lancet. Lancet is one of the most famous scientific journals and important journal as well for researchers. To subscribe for the Lancet or to buy an article, new article or scientific article from the Lancet, we should have or subscribe with a bunch of dollars. It is very, very expensive. So this is the reason that Research for Life has decided to provide the low access cost or free access, and this is up to the publisher, not to the Research for Life, to the low and middle income country that are eligible to access the Research for Life collections. And starting from early 20s, the cost cutting became an issue even for wealthy countries. So it became an issue for low and middle income countries as well as the high income country, and this increased the knowledge gap. To access Research for Life, there are restrictions to institutes that are eligible in the eligible countries. These institutes are or include national universities, professional schools, research institutes, teaching hospital and healthcare centers, government offices, national libraries, agricultural extension centers, local non-governmental organizations. However, there are factors that defines if the country is eligible to join or to register for the 5 collection of Research for Life. The first factor is the total GNI by the World Bank, then GNI per capita by the World Bank, United Nations least development country, Human Development Index by UNDP, health life expectancy by WHO. However, countries that has the GNI that exceeds $1 trillion are not eligible to subscribe or join the Research for Life collections. It's very important to tell you that countries under the Research for Life are grouped into 2 groups. Group A, that are or can access the Research for Life with free access, and Group B that should pay an annual fee, $1,500 per calendar year. And to join Group A or Group B, it is up to some criteria, as I just mentioned. For Group A, these are the criteria, and Group B, these are the criteria for Group B. And the eligibility for countries from Group A or Group B is assessed once a year. So each year, beginning of the year, the eligibility committee is deciding which countries will remain in Group A, or will graduate from Group A to Group B, or come back or remove from Group B to Group A. It's up to these criteria. And it depends on different factors, which are these factors that define if a country is eligible and whether the country will form part of Group A or Group B. Okay. This is a map that can let you know or give you an idea about Group A all over the world that is defined with the blue color, Group B with orange color, and not eligible countries in white color. And to participate or to be eligible to join the Research for Life and to access the 5 collection, we should have an agreement and terms of use. This agreement is registered between the registered institution and the publisher partner of Research for Life, and it allows the licensee to use publisher's offer and defines the rule of use of Research for Life, use of credential, copyright, and fair use. And I should highlight here the collection that a country or an institution should or can have access to. It's up to the publisher that is giving the offer, not to Research for Life. And to register for Research for Life, and before and within registration for Research for Life, we should know what Research for Life allows and what Research for Life do not allow. Research for Life allow sharing the password with colleagues, students, and faculty within the university or the organization. Download or print 15% of the resource, use material for educational purposes or make copies for institutional members, use the Research for Life collection on your personal computer or on a device that belongs to the institution, and temporarily, if you are outside the country and if you are participating in a workshop, in a conference or whatever, and you want to access the collection. Now, we have somehow a long list that Research for Life do not allow to use. As I just said, we can use it within our organization, but we cannot use it or share it with colleagues from out of our organization. And please take care, and in case that you are registered with Research for Life, I know some institutions that their username and password have been immediately deactivated because they shared the password with other colleagues outside the organizations, and these colleagues has accessed Research for Life from their institution, so the password have been immediately deactivated. Post content on websites or publish credentials online. Access Research for Life remotely from other installation than the institution device that, as I just mentioned. Access Research for Life programs while traveling. At the time, we didn't have laptops or devices or tablets. So we didn't have the option to access Research for Life or the collection or our account from another country. But now we can access the collection or the portal from another country, but please take care that it should be from your device that have your organization IP address, not from another institution. Download or print complete issue or book. And in this regard, I need as well to emphasize that a whole country. The password have been deactivated for the whole country because they tried to download and print more than they are allowed to. So please take good care when you are eligible for the collection of Research for Life to stick to the 15%. Supply documents available through any Research for Life programs, and since you are downloading these material for free, you cannot sell it. Modify, adapt, transform, or create any derivative work from publisher material. And to participants, please, can you please mute yourself? Thank you so much. And to register for Research for Life, it is very easy. But I need to highlight that it is an institutional registration, not individual registration. And before you register, I please urge you to go through two very simple steps. Step number one, to read the step-by-step guide, and step number two, to to download or to go through the list of registered institutions to ensure that your institution is not already registered. And in case you are your institution is not registered, you may please go ahead and fill the registration form. And if you are facing any problem, you can contact me, give me the information, and I will do the work for you. And in case your institution is already there, and you need the username and password, please go to your librarian, the institution librarian or administrator, because normally the institution is appointing the librarian with the username and password, and he is making sure that users understand the proper use of Research for Life resources. And in case of not, please contact the help desk, and at the end of our workshop or by the end of our workshop, I will go through with you with some questions and a brief idea about the help desk and how to contact the help desk. Throughout the Research for Life content portal, you may access the 5 collections, which are Hinari Research for Health, Agora for Agriculture, OARI for Environment, RD for Development and Innovation, Guali for Global Justice. And as I just mentioned, the main aim for Research for Life, again, is to reduce the knowledge gap between high and low and middle income countries. Actually, Hinari was launched in 2002, and it is managed by the World Health Organization in partnership with the Yale University and more than 160 publishers, and it provides access to a very wide variety of resources, more than 22,000 resources. Agora is launched in 2003 and managed by the Food and Agriculture Organization. OARE is launched in 2006 and managed by the United Nations Environment Program, UNEP, and partnership with Yale University and up to 65 publishers. RD is for development and innovation and launched in 2009. And finally, the Guali program is launched in 2018, and it is in coordination by the International Labour Organization and the International Training Center of ILO, Lillian Goldman Law Library at Law School and the Cornell Law School as well. And to access the Research for Life, we are granting access throughout 2 ways. One, through the institutional IP address, and the second one is through the institution login credential. And please make sure that your IP address is registered in the IP registry. Participants, this is the username and password. I will leave it for 2 seconds to write it down. You will need it since I will try to do a small demonstration in the next section. And this password will be available from today. It will be activated from today till the 28th of June. I would like to highlight, please, that we can stick to two things: the allow and not allow issue, and the end of this username is on the 28th. And in case your institution is registered, the status will be completely different, because this is a training username and password. So the collection you will have access to throughout this username and password will be completely different than the institution or your institution username and password. So if you will need me to give you this password, or you did not take it, please let me know.
Jahan, can you go
Yes.
back? I'm copying it into the chat. Just go
Sure.
back and I will ARDI-ZW500, and the other one is 10240. Okay. Thank you. They're in the chat now. Okay.
Are they in that now? Okay.
Yeah.
So I will give you 1 minute break. I will stop share to share my second next presentation. And we will go through the Research for Life Unified Content Portal. Just 1 minute break.
I'm looking at some of the pictures of people, and I can see that it is cool weather in Zimbabwe. And
Really?
yes, can you send Jihan and I some of the cooler weather, because where we are is very hot right now.
Yes, it is really hot, really hot.
Yeah. Okay, Jahan Gratian can talk now. If you'd like him to do the opening for a few minutes, we can turn it over to him, especially because you have just completed the first lesson. Okay?
Okay.
Petronella, you agree wherever you are?
Yes, I agree.
Okay, Gratian, you're up. There he is. Again,
All right.
wearing a sweater because it's cold in South Africa.
Yes, indeed. My apologies. We couldn't get a good connection earlier on, but thank you for the opportunity. And I'm glad to be here. Welcome everyone to this workshop. It's a great workshop that we are working with you on Research for Life. We know that you are the trainers who get the word out there. So wearing my hat as the chair of the Research for Life Executive Council, I'm glad that we can see many of you working hard to get the word out there. Your support to the researchers, your support to the academics is well appreciated. We want to make sure that the resources and the collections that we have are being leveraged on and used by the researchers so that they can be able to do their work. We know that there is a challenge as far as getting to especially those articles that are behind the paywall. Here at Research for Life, we are ensuring that we can open them up so that we have got access to that research. The idea at the end of the day is that you, as the supporter of the researchers, you'll be able to get the researchers to do their work and the academics to be able to do their work as well, so that ultimately we are able to address the challenges that we have. These are societal challenges that we have, be it in health, be it in environment, in food, in science, in climate change, any of those areas. We want to make sure that they can be able to do that. The leads that we have, the 5 UN agencies that have come on board, are working very hard with the partnership of the publishers to make sure that the 260 publishers we now have are opening up that research, especially to the low income and middle income countries. We want to make sure that going forward, we are not only opening up what is available, but also ensuring that the research and innovations that are coming out from the low-income countries are also shared globally through the publications that are coming out from the low to middle-income countries. This can only be achieved if we have got equity in terms of access, in terms of inclusion and diversity to research. And that's what we're aiming to do as Research for Life. Our pillars look at ensuring that opening up that space so that researchers can be able to do their work, but also more importantly, the exchange of knowledge between the global south and the global north. That's what we want to try and achieve. So I'm very glad that you could join us in this workshop. Again, thanks to Lenny, Gian, Petronella, and all the colleagues that have actually made sure that this is possible. We want to be able to continue to work with you. I myself are originally from Zimbabwe, and many of you guys. And so I'm glad to see the names of the colleagues and the faces of the colleagues that are working on this. I know that with you, we will make sure that we can achieve this goal, to make sure that the scientific publications get to the researchers and you work with them. Also, we want to make sure that in terms of academics and scholarly communication, we are getting the best out of the researchers so that they are contributing their knowledge to the body of knowledge that is available already. And open access allows that to be able to do that. Here is as a transitional technology that we have in Research for Life, we are aiming to ensure that ultimately research can be open and available to all the researchers. So thank you very much. And we have given now the baton to you so that you can pass it on to your researchers, to your constituencies, so that ultimately we can all succeed in this endeavor. Thank you very much. And thank you, Gian, and thank you, Lenny. Great.
Gretchen, thank you for putting the workshop in the broader perspective, especially with your knowledge of the region and coming originally from this country. Appreciate it.
Thank you very much. Cheers, then.
Thank you, Gretchen. And now I will continue with the second section, which is the Unified Content Portal. I will do my best that we can have a demonstration at the end of this section, because the next section is somehow very interesting that Lenny will present. So now I will do my best to let you understand how to access resources from the Unified Content Portal, to understand the coverage of the 5 collection, to browse and search the content for Research for Life effectively, to use the hamburger menu additional tools, understand content country collection, troubleshoot known and ask for assistance. I think these 2 points, we will go through these 2 points by the end of our workshop. Throughout the Unified Content Portal, there are the 5 collections, as I just mentioned, Hinari for Health, Agora, RD, Ware, and Gwale as well. And since 2021, Research for Life has launched a new content portal that reorganize and enhance access to numerous journals and books and other electronic information resources that are very interesting and useful for researchers. And to access Research for Life, we have one dynamic URL. You may please copy and paste it in your browser. It will facilitate your life and make it very easy in the future when you need to access your Research for Life.
I'm typing it into the chat.
Yes. You may as well access RD and Agora portals separately, since Agora and RD has their own portals for some institutional reasons. But you can access the 5 collection throughout this URL as well. Now, in case you already accessed the portal, just click on the access the content and you will be directed to this secure login screen. You may type the organization username and password and change the language to one of the 6 languages that are available under this tab. But I need to emphasize that you must use the login credential of your institution, and they are both case sensitive, and please no spaces at the beginning or end of the username and password. Sorry. And in case you are facing any trouble, you may contact me, contact Lini or the help desk. As I just mentioned, that you will access either the 5 collection or Agora or RD individually. The Research for Life is providing persistent login for 3 months of recognition for a device that is used to connect to Research for Life from an approved IP address or one of the Research for Life institutions. This is how it will look like, the welcome page or initial page for Research for Life, for Agora and for RD. Starting or in July 2022, Research for Life have made some very interesting update to the Unified Content Portal. One of the very important updates is the A to Z horizontal list. I will explain into details why this list is very important. And it will be displayed at the top of each result page. The second update is the title provided and free content tags. The access to content, as I just mentioned, the hamburger menu, and the report and title lists. We will go into details throughout these 2 updates in the coming slides. So there is 2 ways to access the Research for Life Unified Content Portal. Number 1 is to scroll down to the bottom of the page. You will find this rectangle, and these titles are hyperlinked. So you may click on any one of these titles, Canary, Agora, RT, Wari, and you will be directed to the required collection. Now you access the portal, and I have this is one of the display page, and as I just mentioned, you will find displayed the A to Z horizontal list. I listed or selected the N letter. And this is why this list is facilitating your life, because when you are selecting the N or any of these letters, it will direct you or scroll you down throughout directly through the section that contains all the resources with the letter N. But in case that we do not have this list, you will be obliged to scroll down manually throughout all the letters. So this is facilitate your search. As you may see or notice that we have 2 green buttons or boxes that are displayed beside the search result, which means that it is a free content, and unfortunately two gray buttons. That means that we do not have access to these resources. At the display page, we have at the bottom, at the top right of the page, we have this nice person symbol. This symbol is one of the signs that you correctly log in with your username and password, or your institutional username and password. Otherwise, if you are not corrected, logged in, this person should be in black, okay? And when you appoint your cursor to this nice guy, you will, your username and password information will be displayed. The summon search box will be as well displayed at the initial page of each portal, either Research4Life RD or and Lenny will talk to you into details in the next section about how to use the summon operator and the Google Scholar as well. Okay. So the second, I just told you that there is two ways to access the portal. One we just mentioned, and the second one through from this the horizontal menu bar at the top of the display page. You can change the display language for the portal to Spanish, Portuguese, French, Arabic, or Russian. But I would like to emphasize here that you are changing only the display language, but the content remains the same, meaning that in Arabic countries, same like mine, if I am changing the display to Arabic, it will be displayed in Arabic, but the English content will remain English, French content will remain French, Russian will remain Russian. And to select a collection of the 5 collections from the collection drop-down list, and to select a resource, either books, reference, databases, free collection, publisher, whatever, you may select it from the content drop-down list. This is how it will look like the hamburger menu from the mobile phone. And at the left column of each page of the portal, you will find a series of filters. You may filter your query, your search by collection, and you may notice here that beside each collection, the number of resources that are available in the portal. You can filter as well by content type, by publication date, and this is only for books, by author, by subject. And here I want to tell you that you do not have stick to the 5 main disciplines for the portals, but the portal has many other subjects than the 5 disciplines. So whenever you are running a search with whatever subject, you will find a result. You can as well filter your query by language, either English, German, French, Spanish, access type, or publisher name. Now, I will show you how to access the portal as I just said. So for collection, I definitely, as I am WHO, I selected Heneri. And you may notice that at the top of the page, the Heneri logo and content associated with Heneri is displayed. and the number of resources that are available in the portal in the Hinari collection. And at the right, the access key that explains the meaning of the green boxes that are displayed beside each record or each resource. P for title provided, open access content OA, F for free content, and unfortunately, as I just said, that the gray button for no access, which means that the publisher is not giving you access to this resource. And to clear the search, you may please click on Home. I just want here to give you an idea how it will look like the other two portals. This is RD initial page. And now, in light of what I just mentioned, please let me know, and we can think together, what do OA mean in the access key box? Does it mean open available, open access, optional account, other access? So I will be with you now in the chat, and you may please type your answers in the chat. Let's think together to change our mind.
Looks like we have an agreement.
Yeah. OA. Good, 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 good. Thank you so much. This means that I am good.
That's right.
Okay. Thank you, colleagues. Thank you so much. Thank you, thank you. So it is open access, yes. So now to access the content, we need, for example, to access databases in Hinari. So we will go, as I just mentioned, to the content drop-down list, select the database, and it will direct us to the databases in Hinari. You will notice that at the top of the results, it is displayed the content and the collection. And in case that you need to change or to delete, you don't want, for example, Hinari, and you want to select Agora. Just click on this cross and select Agora, for example. And here, if you notice that we have the number of resources that, or databases, sorry, number of databases that are available in Hinari in the portal, which is 27 databases. And as I just mentioned, the horizontal A to Z list is displayed at the bottom of each result, and the key access as well is also displayed. And you may activate the summon search engine from the magnified class that is displayed at the bottom of the page result. Here we retrieved 3 resources that display the letter F beside each resources, which is the free content. So if I have these letters free, and I want to emphasize again that the collection available in your institution will be different than we have now, because either I access the portal with the WHO account or with the training username and password, which will completely differ than yours. Okay, so to search for journal, same like we did before, from the collection drop-down list, I will select a journal, and here I selected environmental science as as subject and John and Wiley as publisher. And I ran the search. I retrieved a long list and I selected the letter A for the journals or resources, journals for John and Wiley that are have the letter A. I have the African Journal of Ecology. I access the journal and I have the volume 59, issue 2. I tried to manage myself and download an article from this journal. Same for the reference sources from the content drop-down list. Select reference sources. And now let's think together. What are the reference sources that are available in Research4Life? Let's go again to the chat and think together what are the reference sources that are available in Research4Life. I'm sorry, I didn't see this message. You are very good. Thank you so much, Prati. And no answer, no problem. I will answer. I will let you know that the reference sources in Research4Life includes encyclopedias, guides, dictionaries, biographical resources, handbooks, and so on. This is some of the reference sources that are available in the Research4Life Unified Content Portal. And as I just mentioned at the beginning of my of the current section, that the portal includes more than the 5 collections or disciplines, main disciplines for the 5 collection. We have in the portal more than 193 subjects. You can notice here that we have astronomy, we have animal health, we have, this is low acoustic and sound. So whenever you are running a search, you will retrieve results. I have run or completed a very simple search with biodiversity, and I retrieved some results. The content I have here 34 journal and 2 books that has the subject of biodiversity. And we have, as I just mentioned, the menu bar at the top of each page, as well as the access key, the symbol person, and the magnified glass where you can activate the summon search. And this is how it will look like when you will activate it. Same for the publisher. From the content drop-down list, select publisher, and I selected here John Wiley and Sons Journal as publisher, and I retrieved here we have 1,671 journal for John Wiley and Sons, and it is a must that you have at the top of the results the discipline you selected. We have 6 books and 3 reference sources that are related to John Wiley and Sons journals. At the beginning, I promised that we will go through the additional tools that have been updated in the hamburger menu for the Research4Life or in the Research4Life Unified Content Portal. I will go through now the search content and the personal sign-in. I will start with the search, the personal sign-in. If you are already a user, so you will type your username and password and log in, and then you will log into your account. And if you will need help from the help desk, please click on the Need Help Login. and someone from the help desk will contact you immediately. And if you are a new user, you will register, okay? And when you are appointing your cursor to the personal sign-in, you will have all your username and password information. Now, you have an account and you logged in to your account to the content portal throughout your account. I have here completed a very, very simple search with pregnancy. If you can notice that the search term is highlighted in yellow, okay? Or the search terms will be highlighted in yellow. And I retrieved the 57 results. And from your account, from the next action drop-down list, you can manage alerts, you can save the search, you can view the search history, and you can create alerts as well, okay? And the search content, same like any other database, the Research4Life has its own advanced search. You may refine your search by using the Boolean operator and or not, or you may limit it by publication title, author, DOI, ISS, and ISBN, or relevance, newest first, or oldest first. These are very simple limitations you can use, and it is very friendly. Now, in light of what we just said, let's think again together. Do the search content in the hamburger menu allow keyword searching? Now I will be with you in the chat. Can we search the content search throughout keywords? Where are your participants? You were very active in the first question. Okay, thank you. Yes. Any other one? Yes. Okay. Any other answer? Okay, no problem. I'm very sorry to let you know that, there is another one. Chat. Yes, yes. Okay, yes. Another yes? Good, perfect. Yes, no. We cannot use the search content tool for Research4Life journal and book titles plus author. As you can remember that we have here said that publication title, we can define the search by publication title, author, DOI, ISSN, ISBN. Then keyword search is not allowed in the content search. Only when we need to search or run a search by keyword, we should go into summon, and that's what Lini will tell you into details in the in the second section. Now, I have run a very simple search, another very simple search in the search content by using public, health, and filtering or limiting the search by end and relevance. I retrieved 364 results. Definitely, my screen did not take all these results, but I have here 4 of them. If you can notice that we have 2 P's for title provided and 2 F's for free content. Again, the country offer, how to reach the country offer from the hamburger menu, the report section, open the report section, and select the country offer. The country offer actually is very important for you and for the researcher in the country because it gives you an idea and a full idea actually on the collection that is available in your country. We can do this exercise when we are done with our presentation with Zimbabwe. I here selected Sudan as the country and the university, faculty, and college as a category. In Sudan, we have 82,173 books and 62 reference 14 databases. This is why the country offer is so important to give you an idea about what is available in your country. And the rectangle, simple rectangle that is available between the two gives you idea and about what the signs that are displayed beside each resource means. For example, offer available for everyone is the green box. The yellow star, offer available beginning in the next calendar year. The X, offer not available after the end of the calendar year. And the cross, offer available to non-paying institutions. So it gives you an idea about what is available and what is not available in your country. The summon, which Lini will go through now, this is how it will look like in each page. And summon is known as a Google-like search engine. It allows user to refine keyword search by content type, publication date, discipline, subject terms, and language. And the most important, that the results are mapped to the materials that the publisher grant access to in a specific country and are linked to the full text and or a preview to the abstracts. I need to highlight something here, that the collection available or granted to a specific university, it's up to the publisher, not up to Research4Life. So the publisher who is the one who is deciding what to grant access to, for example, in Egypt, the university, Ain Shams University, the publisher grants access for example, 15 resources. And in Helwan University, he granted access to 20 resources. It's all according to the publisher, not Research4Life, okay? As I mentioned at the beginning of the section, that one of the updates that the Research4Life added to the content portal, the unified content portal in 2021, is the title list. Again, from the report section, scroll down, select title list. You may download your lists using XLSX format or CSV format. And if you are logged in with your institution username and password, you may download the collection available in your institution. But if you are not logged in, this title list will include all content provided through Research4Life, including what is available in your institution. Now, in brief, I will let you know how to download a PDF and a citation from a journal. Again, a very simple search. I added the Lancet, since Lancet is very important for what I can understand, and I noticed it is very important for all researchers in all over the world. And I retrieved 34 results. Now I selected the Lancet I want, volume 398, and this issue. You may notice that the download is permittable, and export the citation as well. So you can download the PDF and export the citation to one of the expert management systems that are available on your desktop, either RefWork, text, and so on. Additional resources. We have a specific page for help in the Unified Content Portal. This will help you a lot. Why? Because sometimes we are not using the portal for a long time. So you will forget whatever I have said now. In this page, you will find tips for using the new content portal. Either if you want to log in, you forgot the login details, the browsing site, the searching with summon, and so on. You can find the contact us, the about Research for Life, the frequently asked question, and how to access Research for Life as well. And from the hamburger drop-down list, it is very important to know that you can access the training page. So if you want to conduct or organize a training or workshop, webinar for Research for Life, it is very important to visit the training page or the training portal, where you will find all the training presentation. You may download these presentation. You may tailor these presentation according or up to your needs or your workshop need. You will know how get to start. All the MOOCs till now, we run 9 MOOCs. All the MOOCs that we have already run, you will find it there. The webinars that we taught in these MOOCs, you may listen to these webinars. You may get benefit of them in your webinars. And if you want to teach a training or brief someone in your institution, you may benefit from these webinars as well. Resources for librarian and author skills are very important resources, and currently we are updating these 2 pages and partner resources as well. Participants, I hope that you got benefit of my presentation and section. And now if you want to go through an experience, if you want to search in the portal, we can do this now. I want to let you know or go live to the portal and show you how we can change the or select whatever we have said now or get through now. So this is what I meant, that the gentle, simple person will be black. Okay, so I will click on the person, and it will log you to the login screen, where you will type your username and password, and you may change the language to Spanish, French, Russian, Arabic, or whatever. Okay. And this is the help page, as I just mentioned. The collection, you may select one of the 5 collection. The content.
Jahan, your screen is still showing the presentation.
Ah, sorry. Okay. So I will stop share.
Okay.
Do you see now the portal? Dini, do you see the portal now?
No, we're seeing the end of the presentation, I think. Oh, yes, we see the portal now. You're on the
Okay.
help page. Yeah.
Okay,
Yes.
I will restart. So I'm sorry, participants, for this. We have only 4 minutes. I will go through quickly. Okay, this is the symbol, the symbol person I told you about. So in case we want to log in, we will click on the person, and you will type your username and password here and change the language from this tab to English, Spanish, Arabic, whatever you want. Okay. And from the upper menu, you can change the display to whatever you need from. I will click Arabic, so it is changed to Arabic, okay? Or if you want to change it, for example, to Spanish, it is changed to Spanish. I will return back to English, okay? And this is the help here, the help page. The collection, where you can find or select one of the collection. You may go to one of the collection. Here we have Hinari. We will click on Hinari, and you do not have to go again to the display page or the main page. You can check or select from here. You can select the databases. Okay, so we changed to the databases. Okay, and we want Hinari databases. We have 31 database in Hinari. I want to give you a small tip in this regard. So, for example, we are all accessing PubMed throughout the Google. I do advise that in case you are a member or eligible to access the collection, the 5 collection, to access PubMed throughout the Research4Life. Why? Because when we are accessing PubMed throughout Research4Life, we have more access to the more number of resources or article than we are accessing PubMed as a normal or public user. Okay, so I will go to PubMed. Okay, it is free. So I will give you another tip. When you are accessing PubMed as a normal user, you will find this very simple URL. Okay. And when you are accessing PubMed as Research4Life user, you should have here in your URL mentioned Research4Life. I will try, I don't know what happened with my WHO password. I will try to log in with the username and password. I think, Lini, you posted the username and password here?
There's somewhere in the chat. Let me see if I can find it. Okay. I'm looking up.
Introduction.
Yeah.
That's it. I found it.
Oh, there it is. Yeah.
Okay, I will access the portal as a Research4Life user. Okay, here is, I am in the portal, but as a WHO user, okay? So I will access the portal with the username and password. Let's see that I need the databases. What's up? Okay, so as I just mentioned, that databases is displayed here, and I need to access the PubMed. So I will select the letter P, which will direct me to the P section. And here we have 26 resources or databases that are related to Hinari. Sorry, Lini, this is my last example, but I
Okay.
have just 1 second.
Okay.
Okay. So what I want to tell you that when we are accessing any resource throughout Research for Life, we should have login Research for Life in our URL. Okay. And this is PubMed. This is what I meant. When I accessed PubMed as a normal user, I didn't have this part of the URL in my URL. And this is the second tip that you can ensure that you are properly logged in throughout the Research for Life portal or resources in any resources you need. Okay. So thank you so much, participant, and I'm handing over to Lini. Thank you so much. See you soon.
Okay. You're going to unshare, and
Yes.
now I'm going to share. Yeah, I think the point here is that by going through Research for Life, you're getting links to all the full text material that is available in Research for Life, besides the open access material. So your list of resources from the search will be much larger. Now, what I'm going to do is share my screen, and we're going to go on to another presentation. And first of all, let me get my view right. Slideshow. Okay. Okay, and let me just close this. Now you have to get used to a different accent. You're going from Egypt to the United States. So I hope that I speak slowly enough and clearly enough, because sometimes I get very excited, carried away. So if I'm talking too fast, please tell me in chat. I don't mind slowing up at some point. So we have looked at the databases. We've looked at the research resources and things like that. Now we're going to do the keyword searching, okay? And basically, we'll look at a summon search and some of the features. We'll look at Google Scholar. Again, just like Jahan talked about with the, PubMed, you have to go to Google Scholar through Research for Life. And hopefully we'll have enough time to do some quick demonstrations with that. Okay, and then we'll talk about troubleshooting and support. I think some of the first slides I don't have to go over because Jahan mentioned them, and we will see what we can do to speed this up. We have logged in. This is an old password from a different course. We don't worry about that. You have the correct one. And we're going to look at Summon and Google Scholar to do the keyword searches and link to the full text documents available from Research for Life. Okay, as Jahan has mentioned, when you open any of the programs, any of the unified content portals, you see the box, and you can do keyword search in the box, or also it is at the top of the access page when you go into Research for Life. Okay, there's a magnifying glass which you click on. I don't think we have to repeat this. What we're doing, very briefly, We're doing keyword searches. It's a Google-like search engine. Results are displayed with links to the full text, and it's based on what is granted access in your country. And you also have the options to do email, print, or export. Okay? Automatically performs a search appropriate to the summon environment, what the publishers are granting for you. Okay? Here's the magnifying glass, which you can click on and open Search Across Research for Life. Or if you just have opened the portal, you can just go into this box here that is displayed. Okay? So we're going to quickly do, Jahan and I, our background is in health, so that many of the examples are going to be in health, but that doesn't matter. It can be in any discipline. It can be in a collection that is not even listed, okay? We're going to do hospital infections in developing countries. I use the quotes to refine the search a bit more, okay? This gave me, back when we did the search, 373 results. In the left-hand column, you see it says 374 journal articles. I'm not sure why it says one more. You have an option, you can add results beyond the library's collection, but I discourage people from using that. You can limit it to 1, 3, 5, 10, or a specific number of years, and then you can define it to one of these subjects. So we have 373 results. And then here's your box, journal article, full text view, and also a preview. We'll go over these things quickly. So I hope I have some time to search. Now, the big issue, which is relatively speaking, since you're all are from Zimbabwe, is not as big a problem in Zimbabwe. Publishers grant access. They're going to be more restrictive in a Group B country such as Nigeria, which is larger and has, they think, more resources. Okay, so the results for Bhutan, a small country in the mountains next to China and Nepal, and you get 373 results. If you do the results in Nigeria, you get 234. So maybe we'll do this search after we log in with the username and ID that we're using for this workshop, and we'll see how many results we get. Okay? But you are, relatively speaking, in good shape. Most of the material is granted access in Zimbabwe. Okay? We use the quote marks in the "and" to make our search more specific. Okay? So, in the left-hand column, you can refine your search by content type, by, as I said, publication date, discipline, subject terms, if you want to be more precise, and language. Okay? So you have those options to refine this search even more. Okay. So we're back to hospital infections, and we have put on two different limits. Somebody needs to mute themselves. I'm sorry, I can't see that anymore. So we have public health as a discipline for the last 5 years. Okay? And now we're down to 50 searches. So we can easily refine our search and make it more precise. Note that you have to click on the X here, or these limits, these filters, will stay with your search. Okay? Language, of course, we can switch from one language to another. We did this search in French, and we got 72 citations, and almost all of that material was in French. But that's not relevant to you, okay? And as Jahan was talking about, here is a display using the French interface, and you can see that the key terms have been translated into French. Now, this would be good for Jahan because she is absolutely fluent in French and English, and of course, Arabic. Okay, so there's a little symbol here, we're going to talk about that little symbol very briefly. It is the alt metric symbol, and it's telling you how this article has been used in social media, okay? It's been referenced in 2 policy studies. It's been, oh, I can't read that, I'm sorry. It's been in 1 Wikipedia page, it's been tweeted once, and 550 readers have put this in a Mendeley database collection, okay, using the reference management software. So also we have the example of a preview. You often want to read the preview before you go to the full text because it's telling you exactly what information you need. Okay, here's the altmetric badge again, a little clearer. I'm sorry, I should have gone to this slide. Referenced in 2 policy sources, tweeted, etc. And here's your readers on Mendeley. Okay. If you click on the badge itself, it gives you more details about this information, okay? Where it's been tweeted, Mendeley, attention score, context, overview of the altmetric attention score. Okay, let's say you want to save the searches or print them or email them or export them to bibliographic software. First thing you do is you click on the box to the right. Click on the box, and what that will eventually do is below is a cart with 6 saved items with the options of exporting to, printing, or emailing choices. Okay, so you have those 3 options. In this case, we are going to, as I said, we could either export to one of these softwares, bibliographic softwares, we can print, or we can email it to a colleague. And you can see your little cart has 6. The 6 that you tagged are in the little cart. So email is very easy. You just put in the email and a message and you send it to a colleague. Print, if you have access to a printer, which I don't anymore, you just go and click on the destination and the resources will print. We know about reference management software. It seems to have option to export the citations to several of them. And I think there's a way, one of these is also works for Mendeley, because I know a lot of you people use that. So I have done an example with Zotero. I've clicked on Zotero. I have sent a file to Zotero, and I said, okay. And now I have that bibliographic information in my own personal Zotero collection, okay? And here I'm showing you that in my library in Zotero is a collection, note the export Zotero file. And here's the one that I just downloaded from Research for Life, okay? Next, there is one page of advanced search, so you can put on all the filters at the same time if you choose. It's very useful to use. Let me go on here. We are going to look at Google Scholar, and then I think I will have time to do some searches, and we can ask for searches from you. Okay. Quick question, at this point, should we do some searches in Zotero? No, I'm sorry, not Zotero, in Summon, and let's see what happens. Okay, I'm going to close this briefly here, and I'm going to stop sharing, and I'm going to log in. Okay, let me log in with the username and password we have. I'll be right back with you in a moment. Aha. Okay, here's the password. Just 30 seconds here. I should have done this before. Okay, and now I'm putting the password in. And then I'm clicking on login. Okay, I'm now logged in so I can share my screen again. Sorry for the delay. Go back here. Share my screen. Okay. Would someone like to make a suggestion of a search to make? Share. Here we are. Would someone like to make a keyword search that we should put in here? You can see I have my previous one, solar panel and development. Let's quickly look at that one. And someone kindly put a search in chat. So we're looking at, this is using your password for your country. So you'll see the results. Okay. Solar panels and developing countries. Let's see, we have 97 results. Okay, now you can have the quick look, which is going to show you the abstract. And if you click here, you can get the PDF or the full text online, because this is mapped to what's available in your country. So let's take out the quotes and see what happens. A lot of it depends on what you put in. Now, we have 5 collections, and we talk about our collection.
Lenny, you are muted now.
Okay, I should be unmuted now, right? Can you hear me?
Yes.
Yes,
We're
Lenny,
good?
clear.
Yes.
Okay, so without the quotes, solar panels and developing countries mixed up anywhere they mention the word gives you a much bigger number. But again, it's mostly journal articles, conference proceedings. I would like someone to put a search in chat, and we will do it. And Johanna Petronella, can you read it to me once they put it in chat, and I will do the search.
Yes, I'm here in the chat, Lenny.
Okay. And as I said, you can click on these items and put them in your little box up here. You see I have 2 now. Here we go. I'm saving these 3 to my box. And then if I click on the box, I can print it, I can email it, or I can export it, the 3 that I saved. Do we have a search yet for me to put in?
Not yet, participants, colleagues. Can you please put, if you want to search with a specific term or phrase or whatever, in the chat.
Okay, I'm going to do one while they think. And Zimbabwe. Can everyone see this? Mage production and Zimbabwe. Okay. And we're going to search that. Let's see what comes. Only 2 articles. Let's put Africa. Let's make it broader.
There's someone in the chat box.
Oh, good. Now you see, I changed it from your country to Africa, and look, there are 74 articles, and it's looking for the precise term, maize production. Okay, Petronella, please give me the search we would like to do.
We've got 3, maybe you choose one. The first one is curating of exhibitions. Then the other one is antimicrobial natural products.
I'm going to see if I can get to chat. I can't see
the
the chat.
antimicrobial natural products is fine.
Antimicrobial natural food.
Natural products.
Antimicrobial natural food. Did I spell it right? ANTI.
MI.
MI, yeah. I see my typo. Antimicrobial natural food. Let's see what kind of results we get. That's a good topic. Look at that. 25,000 search results. So let's refine it a little bit. Natural food, okay? Let's see what happens. Ooh, a typo by my hand. AND, natural food. So we went from 25,000 down to 620, okay? 589 journal articles. This is where Summon is great. Look at this, 26 book chapters. That's a lot of information. Let's say you have a lecturer who comes in and I need information on natural food and antimicrobial. And look, there are book chapters that he can assign for people to read or look at to develop his lectures. So this is very valuable. There's even 2 conference proceedings. Let's limit it to the last 3 years. Now we're down to 237 results. And again, you can look at the quick look. You can click to the full text down here. Yeah, preview has changed to quick look. Look, we have to change our slides, Jahan. Okay, full text online or journal article. Okay, let's see if the full text actually is going to work. And then maybe we'll go to Google. We'll go to Scholar next. Okay. Oh, there's the chat. Okay. Now I lost what I was doing. Did the full text results? I think I lost it. Telling me to log in. Nope. Okay, so we will go on. Do we want to do one more search here or let's close this? Oh, let's go back to the presentation. Okay. Okay, and all I have to do is change the view to slideshow, and we're going to go on to Google Scholar. Okay, where it's just like what Jahan was talking about in PubMed. I know you have students come in and they say, I Googled this. And you're going to say, wait, let's go to the database that has research information. Let's go to Google Scholar. I'm sure as librarians, you send people to this tool all the time. What we want to do here is tell you to send them to Google Scholar through Research4Life, because then the results will show access to material that is from Research4Life, not just the free material or the material where you click on it and the publisher says, you need to send us $30 US, which is impossible. So you're going to get better results in Google Scholar if you go to databases, like Jahan showed you, G, and then to Google Scholar. Okay? So that's what I did for these slides. All right? Okay, this is an interdisciplinary type subject. It's good for agriculture, it's good for environment, it's good for health. Now, I just want to remind you, when you are searching in Research4Life in Summon or Google Scholar here, it's not limited to the 5 collections. One time I did a search about distance learning in higher education, and I got 31,000 results. In other words, the publishers have put in their books and journals on all kinds of topics. So feel free to search whatever topic. Someone comes in from education or psychology, search their topic and don't worry that it doesn't fit into a collection. Okay, water pollution and pesticides. You know, Google Scholar searches are huge and they're in relevancy order. Okay, so you have 141,000 citations. There are some filters by year, by full text article. It's not as sophisticated as some in searching. But what do we see in these results? In the right column, you see a link to a Research for Life full text article. You see a link to PubMed Central, which happens to be an open access database, so that will work. You see a link to a publisher, but it's also Research for Life. So that may give you the full text, okay? So this is the key. And here are your limits. Limit to search dates, custom range, sort by relevance or sort by date, or include or delete patent citations. You can also create alerts. Now, this is going to get really interesting. Okay, so as I said, you can go to the full text from Research for Life, and if you were to click on this, you'd go to the Research for Life 360 linker, and then the Springer link to full text, and you can get the full text article. Okay, but remember, you're in Research for Life Google Scholar. Just like Jihan said, you need to be in Research for Life PubMed. That's the way to get the most use out of the resources available from Research for Life when searching. Okay, if you go to the Google Scholar little menu here, you can get library links. In settings, select library links. Now, this is going to get interesting. Our colleague, Jahan and our colleague who works with Gratian, did this search, okay? And she added Research for Life Zimbabwe, Research for Life full text. And then she added the University of Zimbabwe libraries. So if you're working at the University of Zimbabwe libraries, you can add that into your search results. Okay? So now, when you are searching in Research for Life, you can get the results for Zimbabwe from Research for Life and also from the Zimbabwe libraries. I'm trying to remember, but I think you have to do this. To add this, you have to go outside of Research for Life. You have to go to Google Scholar directly.
Lenny, I can assist on that.
Oh!
Oh, Mercy.
Oh, Mercy. Please, 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 please.
You are welcome. You are welcome. But
Hi.
Mercy is a colleague of yours. She was born in Zimbabwe.
But about time.
Yeah, hi. Hi, colleagues. Yes. How are you?
How are you, Mercy?
Yeah. So, like, for you to create library links, so that you can link your institution library with your Google Scholar account, you have to do it under Google Scholar. If you go on settings, then library links. But please make sure that your library must be linked with Google Scholar. So if you go on the Google Scholar help, help tab, you can actually find ways on how you can actually link your library with Google Scholar. By linking your library with Google Scholar, you are you are exposing your library to Google Scholar. So by so doing, if a researcher from University of Zimbabwe searches for information on Google Scholar and it is not available for free or through Research for Life, they can actually, and take, for example, University of Zimbabwe is subscribing to that resource, so they can actually access that resource from the University of Zimbabwe library, but they will have to be authenticated first. They will need to enter their library username and password for them to be able to access the resource.
And you've already added Research for Life Zimbabwe. So we'll
Yes.
pick up the results I was talking about previously by searching, going through to Google Scholar through Research for Life.
Do you want me to quickly show them, Lenny? Just 2 seconds.
I think so.
Okay.
Is that all right with everyone?
If you don't mind, I don't want to hijack
No.
your presentation.
Stop sharing. I think it's really important, so please. Okay.
Okay.
I have stopped sharing.
Okay, I
Thank you,
have the. Thank you, Jehan.
Thank you, Mercy.
Okay. You have to allow me to share.
Yeah.
By the way, participant Mercy is our colleague in Itoka. She is the executive secretary. Yes, Mercy, for
Deputy
Itoka.
Director.
And
yeah.
Deputy
Deputy
Director. I'm
Director
sorry.
of
I'm
Research.
sorry. I'm sorry. She is the Deputy Director, and she is one of the most famous and important persons in MOOC. Yes, and she is professional in Google Scholars. So thank you, Mercy.
Okay.
Thank you, Jan. Okay, so now I am actually in Google Scholar. Please confirm if you can see my screen.
Yes.
Okay.
Yes, we can.
All right, so like under you say like you go on to the hamburger menu in Google Scholar, this one, then you go on settings. Then this third tab, library links, you look for your institution. So like you can look for Research for Life. Now we are in Research for Life Zimbabwe. Then you click on search, then you edit, you have to tick it and save. Then you are going to look for your institution library, sorry. Library links. We take, for example, University of Zimbabwe. I don't know if it's actually linked to Google Scholar, University of Zimbabwe. Search. So you see, it's linked to Google Scholar. Then you have to save, and mind you, you can only link your Google Scholar library with up to 5 libraries. You can't go beyond. So now, if I go, like take for example, I've conducted my search in Google Scholar, and there are some resources that are available through Research for Life and University of Zimbabwe Library. I can actually access them using these links. So that's the important thing about linking your university library with your Google Scholar account. But if you are signed in to Research for Life and you access Google Scholar via Research for Life, by default, when you conduct your search, you actually find resources that are in Research for Life that you can actually access through your Google Scholar account. So if you want more information, if your library is not linked to like the Google Scholar, to Google Scholar, you can just go like scroll down to the bottom of your Google Scholar page, and I think it's under search help. I think they've moved it. It never used to be 2 tabs. Let me go back help about Google Scholar. Yes. So search library links. Where is it? Libraries. Library links. So this is the information on how you can actually link your institution library with Google Scholar such that users within your institution can find resources that are within your library through Google Scholar. So thank you very much. Sorry, Lenny, for hijacking
Oh,
your
thank you for
presentation.
your help. Okay, so now I go back to sharing and let's see where I was. Okay. All right. Yeah, we were at that. And all I think I mentioned after that in this is that you can, if you go into, if you have a like a Gmail account, you can, and you have an account in Google, you can go and set up a profile and get alerts. Okay. My profile, my library alerts. And that way, for the topics that you've searched in Research for Life, Google Scholar, or in what Mercy was talking about to set up, you can get results for these topics, alerts sent to you that there's more material on these topics. And then you can open up Scholar and Google Scholar and try to get the full text. Okay. There are features in library. The star one over here allows you to put your search results in your account. And you can, of course, make a little collection. And we're back to water pollution and pesticides. And I have transferred 4 citations to my library. So you can set this up to not lose the search results you have that you think are valuable. Okay. And I think I just mentioned already the idea of creating an alert. And if I put this in, I would now be getting alerts for water pollution and pesticides coming into my email, which is, again, very valuable to keep you up to date. Then you could go through Research for Life and open the full text article, hopefully. Okay, that works out. And again, there's some options to export citations to Bibliotech, EndNote, Ref Manager, RefWorks, but not to Zotero or Mendeley at this point. Although I think one of the options they give allows you to move them to those to Mendeley or Zotero, a RIS file. By activating proper settings in Mendeley and Zotero, a RIS file can be downloaded into Mendeley or Zotero. So that's the other option that's available. There's a very short, a brief advanced search, which I didn't find that useful, but if you choose to use it, that is fine. Okay, common issues. We're going to talk about this later on, about problems and how to address problems. And we'll spend quite a bit of time when we're talking about the publishing and marketing material, talking about problem solving. So I'm going to skip this just to say that this little r4l@research4life.org email address is invaluable. And these people answer your questions right away. Okay. And there's instructions on how to set up the checklist, the information they need when you're writing to them. But we'll go over that later on. Okay. I think that's it. There's a couple little additional resources. I wanted to note, I'm going to stop sharing here, although I could go and do some more searches. I put a note in chat, and this is very important. Everything we're doing this afternoon is available to you, okay? And we're going to give you a brief little, a tiny URL, kind of called a condensed URL, and that is going to be your access to all the presentations we did today, so that you can literally go in and download the presentation and edit it and change it and use it in your training, or review it, because sometimes we're doing a lot in the 4 hours and there may not be enough time. Okay, are there any questions? Are there any questions at this point? John, didn't we have a 15-minute break in at this point?
Yes,
trying
Lynn,
to
we
remember.
have 15 minutes, but we are late, so we can leave now and be back in 2:15. Yes, Petronella?
Petronella, you make the decision about whether we have a brief break or not, okay?
Maybe people at this juncture, they can ask questions in
the chat.
Chat box, yeah.
Okay. And then we'll go on to the next lesson. We don't have any questions. We have a thank you to Mercy. Yes, that was most helpful that you were on, Mercy. You were checking on what we were doing today in your country.
It's always a pleasure, Lenny.
Yeah. Okay. We have no more questions. Jahan, who starts the? Do you start the next lesson?
The next lesson? No, you will start by the scientific landscape.
Oh,
and,
okay. Okay, I will
do
call
the
it up
idea.
right now. Okay, I just forgot for a moment. So I'm going to, here it is. Okay. Okay, I just have to share the screen now. Aha. Okay, so we decided it would be very useful to have a little overview of scientific landscape, identifying and using information resources. We just thought this would be helpful to everyone, and it's great material to use for training, because I know a lot of you have responsibilities for training also. I just wanted to note one other thing. I'm going to flip to another, and then I'll go right back to this. You see this page? This is what you will have access to. No? Yep. Something very similar to this. Let me quick show you. Documents workshop. Okay. This is the page you will have access to. So every lesson we're doing, you see here scientific landscape, here's searching across Summit, here's unified content portal, here's introduction to Research for Life, and a couple others we'll do after this. You will have available to download every one of these, edit them, use them, change them, because they're all Creative Commons license 2.0, and it has that flexibility. So I know that we're trying to squeeze in a lot this morning, but you will be able to go back and study this on your own and adapt it and use it in your institutions. So now I'm going back to this, and I'm going to switch the view to slideshow. And I'm going to quick, if you don't mind, take a sip of a drink, and then I'll be ready. First part is more conceptual, scientific landscape, but using and identifying information sources is going to be very practical information that you can use in training. Okay. So I'm going to talk now. These come from 3 different lessons that are available on the Librarians Hub. Remember that for later, because we're going to talk about all the different resources that Research for Life has. So there is a longer presentation on scientific landscape, a longer presentation on identifying information resources, and a longer presentation on using information sources. But what we did is we condensed the most important things into this one lesson for you. So we're going to talk about life cycle of scientific research, open access, predatory publishers very briefly, repositories, and open science and research data. That's the first part. And then Jihan will do the second part, and then I will do the third part. Okay? So what is this saying here? There is a cycle, the publication cycle, okay, where you create, you evaluate your research, you do your research, you evaluate your research, you publish it, it's disseminated through databases, literature searches, publishers have them. It's available publicly, it's preserved, and then it's reused. In other words, people start quoting the research. If you do a research paper, at the end, you usually say, suggest additional research to be done. So this is the cycle where it ends up in the red here, and someone else is reusing it for a new creation, for a new evaluation, for a new publication, and gets it published, and it goes in this cycle, keeps going over and over. The life cycle steps involves creation, evaluation, publication, dissemination, discovery, preservation, and reuse. Okay? And then we have a whole series of publications on this process. Okay, they were a webinar series. Next slide says, publishing gets the research out, correct? Through journal articles, monographs, conference proceedings. The current system of traditional commercial science publishing, where publishers manage the peer review and publishers process the scholarly publications, really grew in the 1970s, okay? And the peer review process grew in the late part of the 20th century. Okay, this improved publishing in science as professionals were responsible for managing the various aspects. But the problem is the publishers owned the copyright and the publishers controlled the material. So that's why Research for Life had to come along and say, wait a minute, a good large percentage of the world doesn't have access to this material because you're charging fees and only the developing countries can pay for them. So that started the whole process in the late 1990s and early 2000. And Research for Life is an example of that, okay? Publishing today. Peers from common research fields access articles that are submitted for publication and advise on acceptance or rejection. This is called peer review. It's known that acceptance or rejection for authors' submitted papers may be a key indicator of the quality of the journal. There are these tools that talk about impact factors and so-called top-tier journals. But there are a lot of biases in how the impact factor is developed. For example, I have a friend who published about dermal drugs going through the skin, the dermal process, okay? There were only 3 journals in the world that published that material. So they're not going to have a high impact factor. But if that's your research area, you need to read those 3 journals, even though they may not be listed as a top tier journal. Okay, market share, commercial publishers continues to grow. There are large publishers that dominate the commercial world. Elsevier, Lippincott, Williams and Wilkin, Nature, Springer. Okay, scholarly in communication has some challenges. Okay, here we are, ever increasing subscription prices, paywall. Now this is very interesting. Let's say a governmental agency in the UK or in Europe or in the US pays for the research. Shouldn't that research be available as soon as it's published? That it should not be behind a paywall because the money that funded the research was public money. So that's an issue that has come up, and that's why you see such, there's a Europe PubMed Central and there's a US PubMed Central, and Authors are required to put their publications there, even if it's in a commercial publisher that's charging for it. There's delays because the peer review process can take 6 to 8 months. There are biases in the peer review process. Let's say the editor sees a publication that disagrees with his own research. He's not going to make an effort to have this publishing say, no, that research makes no sense. Again, the journal impact factor plays a part in research assessment as a measure of quality, okay? And we're only sharing the end product of the research, not the research data. So now we see databases are developing where everyone puts the data and other individuals can analyze and look at the data. One thing that's happened because the data is available is there's a wonderful group called Retraction Watch, and they have a great website. And people will look at the data and say, wait, the data is incorrectly organized or displayed or analyzed in this article. So then there's a whole debate whether this article should be rejected because the data wasn't used correctly. And a lot of that is in Retraction Watch, okay? So we have big deals, the big journal packages that consortiums of universities pay for. We have open access coming about, and even some of the commercial journals have open access journals now. We have preprint open archives where an author will submit the almost ready for publication version of a journal. We have funding requirements. You get money from this, like the Gates Foundation. Every research published funded by the Gates Foundation, that results have to be published in open access, okay? You have open science and you have data sharing. So the world is changing and getting more dynamic, okay? Okay. This just repeats the peer review process. Common research fields assess articles by peer reviews, divide acceptance or rejection. Is a key indicator of the quality of the journal, whether they're accepting it or not, how many they accept or not. It's used by academic institutions for tenure and promotion. If you are a librarian at a university in Nigeria, you are encouraged to publish if you want to be promoted, okay? Authors usually aim for high impact journals, the so-called top tier journals. It's very difficult to publish in them, and it may not be the journal that really is dealing with the topic that you have done research about, all right? The big deals are for consortiums of libraries. This got so expensive. This model is declining. Many of the libraries have canceled the big deal subscriptions. And then we're getting into this open access movement. And there are several different, it's a different business model because in order to publish in open access, the author has to pay a fee. And that's how the journal is generating enough money to publish. And that is a huge problem in developing countries. And some journals are using, if you're eligible for Research for Life, we will waive the fee for you to publish. Okay, so we have the gold open access model. Physics is way ahead. Early in the 1990s, they started putting all their preprints in a huge database. It gained momentum through scientific output, particularly public funded research should be freely available. Open access makes original research free accessible through the web, free of most copyright. In other words, if it's an open access, the author still owns the copyright. They haven't given it to the publisher because the publisher is going to publish their paper. Okay, scientific output should not be locked behind paywalls. That's the concept behind the open access movement. So we have the gold open access movement, okay? Free general access to final versions. There are some publishers that have set up a subset of free open access journals. The fee is paid by the author or the institution or the funding source, or it's waived because you're from a Research for Life eligible country, okay? And here, so the goal would be to publish in open access journals, publish journals supporting open access to individual articles. That's a hybrid type. If you were to go into Lancet now and read the first page of a new journal, you would see 1, 2, 3 articles are open access immediately. The other 6 or 8 are not. So that's called the green open, green open access has a temporary delay. It might be 6 months or a year, but also some of these journals are making some available from the beginning and some not. All right, it allows everyone to read the publication free of charge. Here we are, the hybrid journals, either in or in a fully open access journal. So you have both options there. Readers are not charged to read. This journal, no journal subscription fee. Here it is, the article processing charge. I forgot that term. The APC is the key. All right, there are also journals with non-APC or waiving policies, okay? And again, if you go to the directory of open access journals, everything is available. Now, since 2015, every article in the directory of open access journals is available in Research for Life. We're partners. In fact, if an editor says, I want to become part of Research for Life, we tell them to register with the DOAJ and go through that process so that they're eligible for Research for Life through DOAJ, okay? Then we have repositories, which are now open and online, Open Archive Initiative, Green Open Access, in which authors self-archive their publications in institutions or subjects, such as this is the physics one or PubMed Central. So if you have a grant from US agency, you have to put the article in PubMed Central, okay? And I think that like the Gates Foundation and other big organizations are also saying, put them in PubMed Central, okay? So here's some other options. I think I'm gonna kind of stop here. This is just an example of self-archiving website that you could look at. Preprint versions are there. Post-print versions are the version of the paper after peer review, the author's copy. The publisher's version is the publisher's general PDF file. So you have all these options being put into this kind of database. And then I know there's a lot of issues with predatory publishers, and that's why I mentioned Retraction Watch. While Jahan's talking, I'll get the URL for Retraction Watch, and I will put it in the chat. It is a fascinating discussion that goes on there all the time about predatory publishers. And there have been some cases lately where major significant research, cancer research institutes attached to huge hospitals in the US, and they found out that there were a lot of improperly researched articles were being published where they were changing the results to favor their outcome. So there are big controversies going all over the place. There is a tool that really helps you do this, okay? So if you're working with people who want to publish, tell them to find, think, check, and submit, and use it. In fact, in November, we are going to have a webinar on Think, Check, and Submit. I'm working with the person who's doing it. And again, when we talk about resources, if you go to the webinars of Research for Life, there are a lot of resources helping you to publish, okay? Here you are, here's an example. Check, do your colleagues know the research? Can you identify and contact the publisher? Is the journal clear about the type of peer review used? Are articles indexed and services used? Is it clear what fees will be charged? Do you recognize the editorial board? So it makes you go through this process before you submit a journal, okay? And then here's just the Bill and Melinda Gates open access policies, that everything has to be published open access terms if we give you grant money. And I think here's Ethiopia has adopted a national open access policy. And here's that example. And then I think I'm done. And I'm going to turn it over to Jihan summary, okay? And there are more resources here. And now Jihan's going to talk about identifying information sources. So I will stop sharing and she will call this up. Okay? How are we doing on time, Jihan?
Yes, thank you, Lini. So I need to share my screen.
Yes. And I can rest my voice.
Thank you, Lini. So, no, this is not the one. Sorry. Yes, this is the one. Okay. So, I will give Lini.
You have to share it again. We're still in the
okay.
Yeah, that's right.
Okay. So, no, I did not share. Just a second.
Take your time. We'll let Mercy go on.
Okay. So, I am sharing now, yes?
Yes.
Okay. So I will give Lini 10 minutes break. He can drink anything he wants, his coffee. And I will talk to you now about the how to identify the information resources. In this section on information resources, basically, we will be using different types of information resources, the access tools, and how you can actually evaluate these information resources. Since it is very important to know and learn how to evaluate our information resources, because we have million and million of publications due to the evolution of the internet and information during the past years, especially within the COVID era and after the COVID era. And it is as well very important to have the criteria that you can use to check these information resources, just to check that it is the right resource for your research. In this section, we will know how to identify the relevant information resource, identify the types of information sources as well, and evaluate them, as I just said. And this will help us to ensure that they identify our information needs, locate them efficiently, evaluate the resource, and use them to the fullest in order to enhance our research, both as user and researcher. And in terms to identify our information, and in order to conduct an effective literature search, you will need to be able to clearly know your information requirements, then translate them into an effective syntax. In this way, you as a researcher can identify the information sources available in the academic world, and also you will be able to use the information tools to retrieve the relevant content. And as you may know, that there are different tools and services that you can use. Just a second, I need to activate my stopwatch. Okay. And the information manager can come to assist the researcher in making sure that they are aware of different types of sources and evaluating where these sources are from, and which is very, very important to ensure where and if they are good resources. And in terms of which tool researcher should use in his research. And employing in the search strategy or technique to be able to the best results and information in the shortest time we can. Actually, when we are deciding what type of sources would be the best meet our needs, it is very helpful and important to understand the information timeline. And when we are talking about information timeline, we should know that the information about an event is passing through a progression of stages. So here we have our timeline, and you know that when something is happening, the first source of information is the social media. And as in a time, you can find this information on the newspaper or the news or TV or radio. And in a week, it can be published in a magazine, and within a month, in a monthly magazine. And within 3 months later, you will find the information in a scholarly journal, where this information is written by experts who made more efforts to show that this information is well put. And in 1 or 2 years, you will find it in a book or books, where you can actually find in-depth coverage of the different topics. So that is basically our information timeline. And in terms of type of information resources, we have here these types of information sources. The primary source is, in brief, is actually the native idea or the native book or article that the author had invented or wrote. We can find this in data or original experiment, and then we can move to the secondary sources that depends on the primary sources. Actually, the secondary sources depends on information that have been already published in the primary sources. And we can find it in review articles or academic books. And then we will move to the tertiary sources. Tertiary sources are somehow very important because they are organizing the information that have been published in primary and secondary sources, and this is due to the huge amount of information that we have now. So we needed to organize these information that are available in the primary and secondary sources, and this is what the tertiary sources are doing. We can find these information in encyclopedias, textbooks, indexes, and bibliographies. And in terms to the advantage and disadvantage of these resources, for the primary sources, you can find original data, but sometimes you find a large volume of information, and for you to go through that information, it can also be a time consuming. For secondary sources, some of the advantages are rapid access to primary literature. And you know, if you want a literature, most of you will consult literature thesis and dissertation. Then in terms of disadvantage, you need to have the appropriate skills and time to be able to search from these different types of information. Coming to the tertiary sources, it is easy to use, ease for access, and they are concise and inexpensive. But sometimes it is outdated and the information are incomplete and incorrect as well. So for the information resources, we have many of information resources, many source of information resources, same like newspaper, magazines, trade journals, academic journals, monograph, thesis, conference proceedings, reference materials, reports, patent website, and I'm quite sure that the first resource we are all going to is the website. And when we are starting a research project, it is very, very important to know where to find the information and what type of resource is offered and what kind of access service and platform you can use. And when we are talking about information access tools, we are talking about what kind of help you can find in this information resource, okay? And here I should emphasize that not all the resources are free and not all the resources are priced. So we have to manage between them and know what is free and what is priced. And concerning the access tools, the types of access tools are various, but we have here some of the major access tools, same like library catalogs and discovery tools, databases, repository indexes, web search engines, same like Google, and this is the first engine we all are using when we are searching for an information. Coming to the most important thing in our research, which is to evaluate our information resource. The key areas to consider when evaluating our information resource, and this is very important because we have a million and million of information resources on the internet and in the library, and it is very important to know and select the useful and reliable resources to our research and our discipline. So the key areas to consider when we evaluate a resource: accuracy, authority, objectivity, coverage, and currency. First thing, we should know who published the document and which institution published this document. What do the publisher list in his qualification? What credentials are listed for publisher? Where is the document published? We should check the URL. Either it is edu for education, or gov for government, or org or .com for commercial. This is very important to decide if we will go through this URL or no. And you will need to check the credential of the author. And the second key is the accuracy. We should know who wrote the page, or who is the author, or how can we contact him. Do we have a mobile number? We have an address, we have a name, we have any contact for the author? Is the person qualified to write this document in this specific discipline? What is the purpose of the document and why was it produced? And we have to make sure that the author provides email, as I just said. The objectivity, what are the goals and objectives of the site or the article or the resource? How detailed are the information? What opinion are expressed by the author? To determine if the page is a mask or for advertising. And number 4 is the coverage. The link, if it is available, evaluated, and do they complete document themes? If it is all images or it is balanced by text or image. For example, in NLM, the National Library of Medicine, we have the OpenEye. OpenEye is completely of images. However, the PubMed is articles and so on. Is the information presented cited correctly? If the page requires special software, and if this software is available free or priced, this make a sense and will be completely different. Is it free to obtain the information, or the site have option for text or frames? Okay, so putting we have the currency. When the site is produced, when it is updated, the timeline for the information. Sometimes we are reaching a site, and it's very important, but the last update was 2020, and we are in 2024. So the information in this case will be outdated. So if we are putting all these information together, so if your page lists the author credential and its domain is preferred, either edu.gov.org. Number 2, the accuracy. If your page lists the author and institution that published the page and provide a way of contacting the author, either he is a he or she. Number 3, the objectivity. If the page provides accurate information with limit advertising and its objective is presenting the information. Number 4, the coverage. If you can view the information properly. And number 5, the currency, if your page is currently and updated regularly. And the links are also updated. Okay? So now I am handing over to Lini, who will tell us about how to use information resources. Thank you.
Ooh. Okay, I have to share again. Correct me. Share screen. And here we are. I'll be with you very quickly. Okay. Slideshow. So as I said before, this is a separate presentation, and we are using key slides from it just to give you an overview. I'm thinking that this overview is very useful to you, and some of the material can be used in training. So that's why we make everything available to you so you can use it as you see fit. Okay. So now we're going to talk a little about literature search, search strategy, refining a search, Boolean operators, parentheses, and search limits. Okay? You're trying to find out what other people have done in a field. It involves a survey of publications and information on a specific topic. There are various strategies that may help you in your literature search. Okay, simple search, quick and first step search for online resources. Usually done in Google Scholar, a university library catalog, or Wikipedia. You can just use a simple search term or a phrase, but you're just trying to find out what kind of bibliographic information is out there, such as water pollution and pesticides, as I did previously, okay? Then the second one is a more sophisticated search, requires more comprehensive strategy, complex. You're really honing in, you're focusing on a research project. And I'm sure some of you have had students come in and say, I'm a senior, I need to do this thesis. I Googled this. My professor said, go into the library and learn how to search. In the best places, the professor teaching the research strategy, the literature search course, the research course, invites you in to show the students how to do this. But it doesn't always work like that. Okay, you're done for a complex piece of research which aims to identify, select, and synthesize all the research so that you can do your research based on what other people have discovered. And of course, we use Boolean logic. Okay, a really neat option. And you will see this at the bottom of a PubMed search, at the bottom of a citation in a PubMed search when you open up the full citations. And you can also see this, I think, in Summon as a little bit of this too. Snowballing. Okay, it involves using a key publication on your subject at a starting point. We were just on holiday where there was some snow, and my 14-year-old grandson was throwing snowballs at his mother. I have a nice picture of that. Okay, the references listed are your key publication. And then at the bottom, it says related publications. And you look at that list and all of a sudden you say, oh, this is exactly the topic I'm looking for. Oh, this expands what I'm learning about. Oh, I need to add this to my literature search. And then you go into those articles and they may have more really useful articles. So this is a good way of building a very comprehensive literature search, okay? And again, as it says in the bottom, PubMed, that's it, and Scholar have links to similar publications. So if we went back to Scholar, at the bottom, it would say additional links or similar links. So that's a good way of building your literature search, okay? Background information comes from encyclopedias, newspapers, books, and reviews, those tertiary sources that Jihan was talking about, okay? Then you have to narrow your research focus into a question. What, where, who, why, and how. So you have 4 W's and an H. What, where, who, why, and how. Okay? I tend to like this slide, but Jihan made it where in her version, you open one of these at a time, but I went back to my version of this presentation. First, you ask, state your topic as a question. Ask if your question is too broad or too narrow. Define your information needs. I cannot just go into Google. I cannot go to Wikipedia. I need to find the real research. Identify the concepts, okay? Ask what are the most important terms in the question. Select search terms, okay? Here's where you're looking for unique words, synonyms, plurals, broader terms, okay? Then you look at your sources. If we're doing serious literature, indeed, we would be going to things like Google Scholar, okay? Do your search. Ask if you are searching efficiently. You might also do the search in Summon to see what material is available directly through Research for Life. You revise it. Ask, have you done the right questions? Have you gotten the right information? You manage your results. Basically, managing results would be using a reference management software so you can organize it properly. How can you get the full text and how can you use this information in the future? That would be the reference management software. Evaluate. And Jahan talked about this. Can you trust the information you have found? Is the article highly cited? Okay, you have to evaluate all the sources, okay, and apply. Okay, what you're doing is you're checking that you have done this properly, and if necessary, you go through the process again using different terms or broader terms or narrower terms, etc. Okay, I like this one. There is no such thing as a perfect search. Think critically and judge your information. A filter, of course, helps you refine it. A filter can be applied before a search, during a search, or after a search. Okay, you say, oh, this term is too broad. Let me put a filter in. Okay, like, oh, I only want the last 10 years, or I only want articles, journal articles, things like that. They're used to improve and evaluate your search. Okay, a search on a broad topic, such as globalization or organizational behavior, will give you too many results. Use strings of words to retrieve more manageable lists. Okay, remember, all search strategies do not function the same way. For example, now we see and, or, and not, and I'm sure you're all familiar with that. PubMed says, and this actually, I've been using PubMed since the 1970s, and now they're saying, excuse me, do not put in and, or not. We will take care of it. We have programmed the search in a way that it understands you have to use these terms. So you just type in your terms in PubMed. But after many, many years of using and, or, and not, and quotes, it's very hard for me to do that intellectually. I can physically do it, but it still doesn't make sense to me. So and is the one used to combine two terms, or is used one term or another term, and it broadens the search, and not eliminates terms. If you for example, if you're doing research on guinea pigs, you have to take out the country Guinea, which is spelled the same way. Okay, proximity searching, I use the quotes. You can use the parentheses. You've got the asterisk or the dollar sign. To expand the term child, we'll give you child with an asterisk, child's, and children. And you have the question mark for different spelling. And that's pretty true between American and British English because anesthesiology and gynecology are spelled slightly different. So you could put in a question mark. Okay. Most databases allow you to limit a search, and we just used one from Scholar, which is fairly simple. The PubMed filters and the summon filters are more sophisticated than this. Okay. Okay, we focus on building search queries. There's a lot of additional literature. This reminds you how to contact Research for Life. And now we have added, and I do have to mention this because I don't think Jahan did yet, we're really trying to work with the UN Sustainable Development Goals. And you can also use this in your presentation, in your training. Okay, increase research participation from the global south. In other words, Research for Life used to really focus on, we're getting you information. This is how you get information. This is how you search information. But now we've had webinars and collaboration with other groups and short courses on what you do with the information, how you write, how you publish. Because without those skills, it's not sufficient just to have access to the information. So this is where the Sustainable Development Goals fit in. And we, of course, our primary one is partnership for the goals as we partner with private companies and agencies, okay? And again, SDG 17 is very important, reduce inequities. We really say we touch all of them, but another key one is quality education is fundamental to create a peaceful and prosperous world. And of course, gender equity to achieve the empowerment of women and children. So this you'll see in a lot of our presentations. We also talk about this. And I did want to spend a few moments talking about how the strategic plan changed to incorporate more of these concepts. Okay, Jahan, we're done with that one. And I think you start the next one, so I stop sharing, but I will be ready to go for the part I have to do.
Thank you, Lini. Yes, I will share my screen. No, Lini, you should start.
Oh, okay. Just a second.
Yes, start the first section, research for life, marketing, and workshop toolkits.
Okay.
And then
So let me make sure I have it. I have to open it. I'm sorry, I'm a little behind. We are now going to the training and marketing material, right? And the first part is I'm doing the
workshop toolkit.
Oh, is it on here? No, I have the wrong one. Oh, there, yes, I have it right here. Right here. I'm good. I'm sorry. Okay. So let me share again and we can proceed. And I have to do the last part of this one too. Correct me. Okay. So this is one that's going to be complicated and we may take up more time than we allotted for it, because this is about where there is material for you to use, how to use it, where you solve problems that you have with Research for Life, okay? Where there are other resources that help you resolve these kinds of issues. Okay, so we're going to start first talking about training and marketing, okay? Oh, I have to change the view. Slideshow. There we go. Thank you for your patience. Okay, we're going to talk about training material, promotional material, help desk resources. How do you solve problems? What do you do if you don't have your username and password? We're going to spend time on that. So this gets complicated, but it's very practical, okay? Slides discuss varying training and promotional material that's available. And we're going to talk a little about our MOOCs, our webinars, and things like that. Okay. The horizontal bar of Research for Life has two key drop-down menus. One is training. And you can see in there's an authors hub, there's a librarians hub, there's webinars. At some point, we won't have time to go over all this. Explore this. And then also we're going to talk about the marketing material, okay? And resources for partners. So if you open this and you click on training, you get this page, okay? Getting started with Research for Life. Introduction to Research for Life, video tutorials. Then we have our MOOC, which we just completed this year. Once a year, we have a fairly comprehensive MOOC. We have had webinars on so many different topics, especially recently about writing and publishing and other resources that are available. So take a look at the webinars we have. Then all these other, our partners, all these other publishers have free resources, especially about writing and publishing, okay? Then there's an authors hub that focuses directly on how to publish. Some of these are out of date, and some of them, the material is in webinars now. Librarians Hub. This is for you people. What we did is we took every course from the MOOC and we made it into a PowerPoint presentation. So this will give you access to all the PowerPoints, the ones I kept talking about. Remember, I said, this is part of a bigger PowerPoint. They are all available and downloadable from the Librarians Hub. In fact, here's the list. I think it's 18 or 20 different training presentations. You can see they're in multiple languages. And very soon, they will also be available in Arabic because Jahan is finishing the editing of the Arabic ones. And this is quite an achievement, we think. So you can see identifying information sources, using information sources. We discussed part of those. Copyright. We didn't discuss that today. Citing references. We didn't discuss that today. We did the Unified Content Portal. We did Search Across Research for Life. That's Scholar and Summon. You can see there are discipline-specific resources. And then there's a couple on disseminating research output, writing and publishing. And finally, we have some toolkits and other resources to help you organize things at your institution. All right. So the first one I'm going to talk about is marketing strategies. If you clicked on this little box here, again, these are in the Librarians Hub. You click on this box, this is what shows up. And this is just going to be a 2-minute overview. You need to look at this and you need to take your time. Client groups. You're going to figure out what each group needs, okay? You have students, you have undergraduate students, you have postgraduate students, you have faculty. If you're in research institute, you might have just 4 or 5 different groups of researchers. So you might put there researchers that cover these topics, researchers that cover these topics. If you have nursing, you may have undergraduate, postgraduate, faculty, researchers, okay? And then you click the boxes, X, 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 X. They need this information. Then you look at Research for Life and you say X, X, X. Yeah, they need the ebooks. Oh yeah, they need the review journals to learn what literature is out there. Oh yeah, they need the research journals. And here's your group for postgraduate students doing a thesis, and they may need all these things. So this tool, which is available by clicking in the Librarians Hub on this, gives you this spreadsheet downloaded. Here's an example from a College of Nursing, actually from Papua New Guinea. And they put down lecturers, nursing students undergraduate, nursing students postgraduate, and they clicked on all the boxes of the type of information they need. And then here, you see these in bold? These are databases and research reference sources that are in Research for Life that particularly deal with nursing. A Scholar, of course, is broader, but CINAHL is nursing database. Cochrane Library is evidence-based medicine. So this gives you an idea of who needs what in which discipline at what level. Then there's another one. If you click on Presenting About Research for Life and you go to the workshop plan tool, you get a similar one. Okay, I have to teach the 4th year nursing students. That's my client group. Remember, I had those columns on the other one with client groups. And what are they doing? Beginning their literature searches for their graduation thesis. So they need knowledge of basic information literacy. They need to how to identify and read current research information. They need to keep track of them. Students will have proficient with basic technology to attend course and learn content. Have to be proficient. So, what information needs are they? Current research information. They might also, I would have also clicked review information, right? statistics they need. Others, they need a cool tool to keep track of articles. What are we saying? You have to teach Mendeley or Zotero, one of the reference free, or one's open access, one's free. They're the best two, I think, most easily available. You could always ask Mercy to help you with Mendeley. She's an expert on it for sure. She teaches that regularly. Okay, so here we are. What Research for Life materials will be useful? Researcher training webinars. We may have a webinar that's useful. Some of the PowerPoints may be useful, okay? Some of the videos may be useful. And look here, reference management tools in Authors Hub. And what do you want the client group to learn? Here are your learning objectives. Navigate Hinari and assess material. We'll learn how to navigate PubMed and access material. We'll learn how to and apply reference lists using Mendeley or Zotero. So this little tool teaches you how to create a course. And now we get the honor of, I turn this over to Jahan. Jahan, do you want to, I should stop sharing and you go from here, right?
Okay, thank you, Lini.
Thank you.
Okay. Now, I will give you a brief idea about the training and promotional materials for Research for Life. I will focus on these materials since these materials are very important and useful to implement or go through any workshop. For example, if you are going to a face-to-face workshop, and you want to distribute some brochures. We have in Research for Life this kind of marketing material. And these resources, all the marketing material are located on the Research for Life website for the 5 collection. You may go through and you may download them and print them. And now in terms of these materials that you may use for promotion, we in Research for Life got a number of things that can actually help us in this regard. We have things like posters, like big poster. These big posters, you can place it printed and place it in your institution public area. Whenever you are going to an exhibition, especially in person, when I went or I'm going to an exhibition, I'm taking some of these big posters with me, or when I'm going to a workshop, Hinari workshop, I am printing these brochure and posters and distribute it to the participants, and it is a kind of marketing and promotion for Research for Life, because these posters will deal with the participant and they can give it to another one, so it is a dissemination for Hinari. You can print this the marketing materials from this URL. And we have as well the brochure insert, which is available in Arabic, English, and French. And you can print it from this URL. As well as the toolkit for registered institution. It is a way to ensure that your institution is registered for Research for Life or not. And the very important thing is the advocacy toolkit. The advocacy toolkit is available in English, Spanish, and French, and it is very important to promote and advocate for Research for Life. It will give you the opportunity to be an ambassador, to advocate for Research for Life in your country or your institution. and it will help you as well to organize a new toolkit for yourself in your institution. So it is very important to download it and to read it. And there is a presentation, as Zini just said, for the advocacy toolkit in specific. I think it is module number 6. You will find the advocacy toolkit presentation in module number 6. The Research for Life has as well the Stories of Change, which is a series of videos and photo stories showcasing the impact of access to information in the developing world, the case study booklet, the testimonials, and videos that have been posted on Research for Life YouTube channel. You can download them and access them throughout this URL. This URL will, let's try it, will lead you to the voice page for Research for Life, okay? The communication team for Research for Life will be very happy to assist you and to help you to post your stories and to communicate them throughout the official channels of Twitter and Facebook. Facebook, please copy and paste this URL for the Research for Life Facebook as well as Twitter. You can tag as Research for Life partner in their tweets about Research for Life. As I promised at the beginning of the workshop, that we will go through some cases that the help desk colleagues in the help desk are facing, and how to deal or how to contact the help desk. Okay? Okay. So when I was talking about the registration, I urged you to download the list of institutions. However, your institution or organization can be registered for Research for Life, but you will not find it in the list that you will download from the site. The list from the site lists the universities and professional schools. However, if your institution is academic or research institution, government office, national library, or agriculture extension center, or an NGO, it will not be listed in this list, since we consider that these are somehow confidential information. And you will please, I please urge you to contact the help desk, please, at r4r@research4life.org. Another case that the colleague in the help desk are exposed to, who can access Research for Life? Actually, the help desk is sending the login details to the librarian and director. So these are the main focal points for Research for Life in your institution. However, all staff in the institution are eligible to access Research for Life as long as they abide by the license, same like professors, admin, and students. However, I would like to highlight that there is a summary of the license that is available at the frequently asked question page. You may go through, please read it to know what user can do and what they cannot do. On the other hand, any library or any big library, same like our library in Amro or the National Library of Medicine, can receive out on-site visitors. who are the walking visitors to the library or they are not members in the institution. And they need to log into the collection, the Research4Life collection, my collection for Hineri, for example. In this case, we will need a staff member who can access this collection. The visitor can access the collection in the institution, but please, the on-site visitors cannot have the username and password for the institution. If they want, they can access the collection from the institution, but they cannot have the username and password. You can get the institutional name and password, as I just said at the beginning of the workshop, from the librarian. And if the librarian don't have the username and password, please contact the Research4Life at r4l@research4life.org. How can the institution get the username and password? The help desk actually is sending the username and password to the librarian and the director. Then the librarian should be appointed with the username and password. In case that you cannot reach or the librarian do not have for any instant the username and password, just send an email to the help desk with these information: the country name, the institution name, the librarian name and email, and preferable an institutional email. If it's not available, it's okay, the personal email. The institution director name and email, as well as the computer support contact name and email. Okay? And in case that you are leaving your institution, if you can remember that in the list of allow and do not allow, that we cannot use our institution username and password in another institution. So the answer is no, you cannot use your username and password in your new institution. But you can do something very nice to brief the librarian in your institution, and this is in case that you ensure that they are not registered for Research4Life. You can brief him about the Research4Life, what they can benefit, and how to register for Research4Life. Okay, and this will be very, very useful for your new institution. And in case you are the librarian of the institution and you are leaving the institution, in this case, please hand over the username and password to the new or your replacement in the institution. Give him the username and password, and please send the new information for the new librarian to the Research4Life help desk in order to update their record. This is very, very important, and we can face this recently. When you are trying to access the unified content portal and typing your password, and your password is not working. Number one, we should check with the librarian that we are using the correct password. Okay, so now we know that we are using the correct password. We have two things to do. If we are copying and pasting the username and password, we have to ensure that there is no spaces at the beginning and at the end of the password. Okay? Number two, I should refresh the page. Close all the open tabs, okay, or browser. Open a new browser and copy and paste this URL to access the portal. These are the two steps we should do to access the portal. And in case that the password still not working, in this case, the librarian should contact the help desk. Why I'm emphasizing on the librarian? Because the librarian, he is the one in charge of the username and password, and these are confidential as well. So in case the help desk is receiving any email from any person from the institution, and this researcher or student or whoever is asking for the username and password, the help desk will not reply to this email. The help desk will reply only to the email of the librarian that is registered at that end. Okay? Just a second, I cannot read this. You cannot access a book or a journal or the full text of an article. And since the Research for Life is to help to get access to the content you are eligible to access or the publisher offered, it can happen that several times you cannot reach any of the resources or the full text or whatever. In this case, please start to check with the librarian what is the situation. Maybe something had happened, the publisher changed the list of eligible or accessible resources or whatever. So we have first to check with the librarian, and then if the problem still persists, we will report to the Research for Life help desk. But please be precise in the information I just mentioned, okay? As I just mentioned, that there is a section in the frequently asked question regarding the license. You may please read it by, but generally we cannot change anything in the agreement or the license. It's not signed by all the publishers, since there are many publishers in Research for Life, and we cannot let them sign. And as well, we cannot change anything in the agreement. Yes, you can ask and request the help desk for usage statistics, but unfortunately, we are only providing login statistic, and we are not providing document views or downloads journal statistic. And only, as I just mentioned, the librarian and the director who can access or ask for these information. Again, we are considering these information as confidential. And it is requested, or it is, these information are available twice a year. One at the beginning of the year, let's say in January or February, and the second half of the year at the mid-July or end of July. So if you will send to ask the help desk for these statistics, let's say in March, these statistics will not be available for the second half of the year. It will be available for the first half of the year, okay? Now, for the frequently asked question. Actually, colleagues in the help desk have made a great effort during the 2 or 3 last years to update the frequently asked question page. So I urge you, please, in case you have any query or any question, please check first your question or query in the frequently asked question. You may find your answers or what you are looking for in this page. In case that you are not, you do not find your a satisfied answer to your query, please contact us at the help desk in this case. And all the help desk resources will be including the slides. Definitely, I did not go through all the slides or all what the help desk is doing. I picked some slices, the important slices, but the full PowerPoint presentation, you can download it from this URL. The frequently asked question page, you can access it from this URL. The help desk content information, I will go through in my next slide, and the useful tools and links, you may please go to this URL and download it from there, okay? Now, to contact the help desk, we have a very simple and quick checklist. I please need you to follow these instruction or this checklist because it will facilitate a lot the work of my colleagues in the help desk, and they will and it will help them to respond to your query as soon as they can and as soon as possible. Number one, they will need the country name and institution name, the username and password, definitely institutional username and password, the IP address, the failure authentication message you are receiving, a brief about your problem, what you are facing. You cannot access the site, you cannot access the content, the whole content, or a specific journal or a book, along with a screenshot in the body of the email and the URL of the error you are facing. Very simple checklist, but please follow this list. As Lini just said, that you can download all the materials we went through in this workshop by just copy and paste this URL in the browser, and you will be directed to the folder that Lini displayed at the beginning of his presentation. And now Lini will show you a list of the institutions that are available in Zimbabwe in case that you need to register for Research4Life. Please contact us. This is Lini's email address or my email address. I will leave it for seconds. You may contact us if you have any problem. You cannot contact the help desk. You need me to register for you for Research4Life. You are more than welcome to contact us. Lini, are you ready?
Yes. I just
Okay.
have to share. You unshare, I share, and we're good. Okay. Here we go. Okay. We have the extensive list of every institution, every city, every category, and the contacts, okay, and the email addresses and the names. Some of you are from institutions where the contacts have changed. Some of you may be from institutions where you don't have the username and password. If you see your name as a registered institution and you have any questions about that, you write me and I give you the names of the current contacts, and then you can write to the help desk and change them. Or you can send the information to the help desk and say, we need our username and password. Here are the updated contacts. Okay? So that's the first group. The second group, there may be some of you who are not registered. The resource for that is Jahan. She will help you register. Okay? So I'm going to very slowly, we've seen through Center for Sexual Health. If you put maybe just put in chat, if any of you, no, I'm going to put my email address in chat also, but John just gave it to me. Just write me an email and say, I'm from Binga Distra Hospital. We have a new director. We have a new librarian. I'm the librarian. I've only been there 2 years. How do I get that changed? Well, we're from Blair Research Institute. We don't have our username and password. What do I do? And we will work our way through all of them. So let me go down a little because the last one is now Center for Sexual. So I'm going to put that one at the top. Okay. So now we're going to Chemistry and Soil Institute to Galen House, all registered institutions, including my favorite, the Coffee Research Institute. Okay. Have any of you see your names here and you don't have your username and password, send me an email. Okay. And we'll talk our way through it and we'll get it organized. If you send the right information to the help desk, they will be very happy. So I am really stressing that you communicate with me and we get it right. May I continue down? Galen is the last one. Okay. Now we're at Grasslands Research Station, Great Zimbabwe University. I must say that many years ago, I went to Great Zimbabwe. Maybe 1998 or so, something like that. Very
Lenny,
interesting.
is Zimbabwe Open University in the list?
We'll get to these.
Okay.
Okay. And if it isn't, we register them. Okay.
Sure.
So may I continue? We're down to Island Hospice and Healthcare. Okay. And now we're going from Joshua, I will not pronounce it right, Polytech College, down to Medical Research Council of Zimbabwe. Okay. So now we're down to 70 different institutions. Let me wait 10 seconds and we'll go on to the next one. Oh, which was the last one I was on? Medical Research Institute. Oh, I'm not. Okay. We did the Medical Research Council, right? Okay, this gets us down to the Ministry of Health, National Nutrition Unit. And you can see like the Agriculture Ministry have several different usernames and passwords. So if you're in one of these and you weren't sure of this, write to me. Okay. And now we're going. Okay, I think we were here. And now we're down to National Biotechnology Authority of Zimbabwe. Okay. May I go on? Biotechnology was the last one. We'll get to the Z's, don't worry. Okay, do anyone here need to communicate with me? You are already registered. Okay. Now SAD TAP is the last one. Okay, now we're getting to U's and Z's. Right, all these are registered, as I said. Okay. Do we see the Zimbabwe? That'll come up next. We have it. Women's University in Africa, Zambezi Society, Zimbabwe Crocodile Research Group. I'd like to go visit them. Okay. Helene. Okay. This might be the last one. Open University. Okay. Was that the one you were asking about, Jahan?
Yes.
Okay. So if that person needs information, write to me and I will give them the information and tell them what to send to the help desk. Okay. That's it. Was this useful? I see some comments in chat. Let's see if any of them are about this. Okay. Yeah. The emails are there. Okay. We're all set on this. Okay. So we are at, okay, I'm transferring the time. We're at 3:25 in Harare, correct? What we're going to do is I'm going to call, I'm going to call up the last presentation and talk about it for maybe 10 minutes. You people have been online for 3.5 hours. We have not had a break. This is a presentation that Petronella really thought would be useful, but it's something you can look at on your own. Okay. Here it is. Okay. I'm going to share the screen and maybe I'll talk about it for 10 minutes and then we can open it up for questions and answers and everybody can call it a day and I will get up and eat breakfast. Okay. I know Jahan will have her dinner. So I need to go to the view slideshow. We have spent the whole day, 3.5 hours, talking about Research for Life, Research for Life, Research for Life access, how to use resources, how to go to this, how to go to that, how to get things answered from the help desk. There is another world, and this presentation focuses on that world, open access interdisciplinary resources. Okay? And what I'm going to say to you is, take your time, go through this, study it on your own. Because I don't think we really have time for me to start opening up databases and do this. Okay? Become aware of existing additional resources which are interdisciplinary and beneficial for many of the Research for Life topics. Understand additional collections and how to use them. Okay, we're talking about aggregator search tools, repositories, free journal resources, databases, publishers, thesis, and portals. Okay, so we have in the left column all these databases through almost every one of them except Worldwide Science go to free resources and they're searchable. I might look at one or two. Then we have the directory of open access journals, but as I said, that material is in Research for Life. Then we have thesis and dissertations, okay? Individual comes in and they want to do a research project. It is invaluable. It is so useful if they can see other people's thesis and they could read at least a summary, if not the results and more content, okay? There's one for Europe. I think this one is for Africa. This is a global one. And this last one is in Research for Life, but it is a huge database of theses. Okay? So those are some very invaluable ones to look at too. And in the last category, we have books. Okay? Except this one, freebookcenter.net, I tried to open it and it said it was corrupted. Okay, we have the directory Open Access Books, National Academy Press, and Open Textbook Library. This may be very useful to your faculty, where they can see if there's a textbook on their discipline that they could use for teaching. So each one has a little introductory page, the link, and then a summary of it, okay? 160 million documents. Largest collection of open access research papers, okay? 179 million papers. Now, they're not quote unquote peer reviewed. You have to go in and decide if this material is relevant, useful, decent research, etc. But Jahan talked about that before. So this is for open, Europe PubMed Central is for agencies that require you to publish the article, government agencies, non-governmental agencies for Europe. Okay? 36 million abstracts, over this is an older statistic. There must be over 6 million articles. Okay? This is one to multiple US government databases. I want to just go, this is one that tells you where open access resources are. Okay, types of articles. It's more like a tool to help you go out and search. Okay, I want to go this one, PubMed Central. This looks like National Library of Medicine. It's all the material I think is in National Library of Medicine. Every one of these has a link to the free full text. Okay, so when you open up PubMed, it says link to full text. That's because they're all in PubMed Central, because the government agencies had to put their research there. Okay. Let me just, those are journals. One last thing. European thesis, okay? Has over 1 million open access research thesis. Okay? Over 1 million. That are database of African theses and dissertations. Okay, when it started, it's got over 30,000 research dissertations now. This is something you may not be aware of, but some of the theses in there would be really relevant to the researchers in your country. This is a global one. 5.9 million documents, full text. Index electronic thesis and dissertation, keyword searches available. And finally, this is the commercial one that is available through Research for Life. You log in, you go to databases, you click on P, and another 5 million titles. Okay? What we're saying is all this material is out there separate from Research for Life. And I think I'll stop at that point. And I will stop sharing, and we can open it up for questions if we have any. I hope that little overview is useful. Again, everybody should have that R for research. Everyone should have that URL. I hope you write it down. That gives you access to all the pages. Let me see if I can find that and put it in the chat group. Okay, in the chat box. And then Petronella, you coordinate questions, anything that comes, send it to us.
Yes, we have a question.
Uh-huh.
Which databases in Research for Life are best for researcher in fine arts, creative arts, and clothing and textile?
Okay, this is a hard issue because we don't have a program, which is now a collection that deals with fine arts, creative arts, and clothing and textile. I would suggest doing summon searches. Okay? And see what kinds of fine arts, creative arts, clothing, and textile information comes up there. That would be nuts. There is no database. We are struggling. We are trying to get a business database, but it hasn't happened yet. Okay, we have health ones, we have legal ones, we have agriculture ones, but we don't have one, say, on your discipline here. Does that help you? I hope so, Jonathan. Okay, so go into Research for Life and start searching, and some of the terms will come up with articles about what you want. Because the publishers have put in many, many journals that don't fit into a category. It's not about agriculture. It's not about environment. Okay? Okay, I'm still trying to find that URL and to put it in. I'm going to share another screen. Okay? Here it is. I'm going to share this screen. Let me go back. Okay, I'd give everyone an opportunity to write this down, share. Okay. So all the course material is in that bit.ly. 3, capital V, capital Q, capital C, capital L, capital K, capital X. I'm going to copy it. And there's the username and password for the week. I'm going to copy it. And I'm going to search it. And I'm going to show you where you end up. Okay, you don't need a password. You don't need anything. You can download. Ooh, it didn't go. Enter. Okay. Now I'm going to stop sharing. I'm going to share again. Okay. This is the page with all the presentations. You can see the one I was open access interdisciplinary resources. They're all there. The answers to the most common questions that Johan used is there. Every presentation we did today is there for you. All you do is put that URL in the box up at top of a search of a Google Scholar, Google Chrome, or any search engine you use, and it will go right to this page. And then all you have to do to download is, I think, click on it, and download, and then it's sending it up to my downloads in my computer. In Chrome, they're up here. And here's the file. Let me open it. Oh, it's just being slow. Being slow. Any more questions? Here it is. So this is the one that Jihan used. As soon as, see? Remember she showed you these slides? So you have all that. You have everything we did today, and you have our emails. If you have requests for more, or you have a question about how to get to the Authors Hub or the Librarians Hub or anything like that. And also send me and Jahan emails. I get the ones about you don't have your username and password, or you have new contacts. And Jahan gets the one about I need to register. Okay? I think I can stop sharing this. You have any more questions? Well, we are now at 3 hours and 41 minutes. I'm sure all of you are hungry. All of you ready to go home? I very much want to thank Petronella for talking to our colleague Blessing, who runs the Country Connector program for Research for Life. And Blessing sent me her email, and it really took us about 10 days to put this workshop together for Jahan and I to figure out what to teach, for Petronella to really help us. How are we going to publicize it? What do we need on the flyer? How do we do registration? Who do we send it to? And we had a very nice turnout here. It looks like almost 80 of you stayed all day, and we really appreciate it. What we did not do is create a little survey. So maybe within a week, you'll get a little survey from us, and please answer it. Okay? Are there any more questions? Jahan, would you like to say something? Petronella, would you like to say something? We appreciate that you stayed with us all afternoon. It shows that you have a real interest in learning about this and how to use Research for Life better.
Yes, I do appreciate as well, and the participants were so cooperative, and they tried their best to be with us and to keep the workshop live. And I thank you so much for listening to us and being so patient. Thank you.
We're very happy to have this opportunity of training you.
Yeah.
Even
Yes.
though it's not face-to-face, it's all this remote. So we really appreciate it. Petronella, please go ahead.
I'd like to thank you so much for the presentations. They were very insightful to both as a refresher, at the same time as a new start to others. Thank you so much.
Okay. Okay, if anyone likes to speak, go ahead.
Hello, can you hear me?
Yes.
Thank you very much for the lively presentation on behalf of Zimbabwe Library Association. My name is McDonald Nagura. I'm the president for Zimbabwe Library Association and also librarian for Harare Institute of Technology. I would like to say we immensely benefited from the presentations. We didn't know Research for Life can offer quite a number of interesting information sources. Thank you for highlighting resources and mentorship for researchers, facilitating collaborations and knowledge sharing, the promotion of science education and public awareness, the support and the development of new technologies and therapies, the open access books, the journals, the 169 million journals, the European thesis, data thesis. Thank you so much. We immensely benefited from this.
Yeah,
and now
the last one, please go and study it, okay? And Jahan and I were thinking a little, and maybe Petronella will encourage us. Maybe we can come back and do a workshop on resources to help people write and publish.
Excellent. We are actually looking forward to that. And I promise you, we're going to invite quite a number of early career researchers and
Early
senior
researchers.
lecturers. They're quite interested in this. Thank you
We
so
could
much.
do a little summary of Research for Life, because we have to say, you need to know where these resources are. And then we have some wonderful presenters on that we can probably encourage, so that two of us don't have to do all the teaching. Okay?
Yeah.
So let's keep in touch with us about that.
Thank you so much.
Okay, very good. Anyone else? Okay.
Okay. Hello, can you hear me?
Clearly.
Yes.
Oh, thank you. I'm Lovejoy Leah, coming in from the Medicines Control Authority of Zimbabwe. Thank you very much for the very detailed and informative presentation. So it's been quite a lengthy presentation, and I couldn't absorb everything. So I might need to refer back to it. So where do we access this particular presentation? Will we have access to it, or is it also on the resources on the Resource for Life? Will it be deposited there? Where can
we will figure that out, and I have to talk to my colleagues at ITOCA, where Gratian is the director, about what we do with making that available. But we have a list of all the registrants, and we have your email, so we will figure out a way of making it available. But at least for now,
Okay.
you have all the presentations. Okay. I
Okay.
know when you do so much, it's hard to absorb everything. Yeah.
Okay.
Takes time.
Yeah. Thank you.
Okay, we will make it available. Okay, Petronella, you get the honor of saying thank you and closing the meeting.
All right. Thank you so much, Lenny. Thank you so much, Jen, for
You're
the
welcome.
presentations. To our participants and listeners, thank you so much for taking your time away from work and learning something new. Thank you so much. We'll meet again in another learning experiences.
Okay. Someone asked for the link to the training material on the chat. There it is. John put it in. Research Librarians Hub, Research for Life. Yeah, there's the link. Okay, very good. Okay, everyone have a safe trip home. Enjoy your families this evening. And I know I will not get up at 5:30 tomorrow morning. So, but it was worth it. It was worth it to teach you people.
Thank you, Lini. Thank you, participants. And if you need anything, please do not hesitate to contact
Yeah,
us.
write to us, especially if with the updating of the librarian and the director, those kinds of things, or I don't have access problems. Okay, please do. Okay, thank you very much. And we're closing the meeting.
Bye.
Bye, everyone.
Bye.
Bye.
Yeah, she's very positive. Physical therapy now. You know, when you were on, you like gangbusters. Yes, I cannot live like it. Tell me what I can do. Yeah, we worked on it. But we kept flipping back and forth, so it wasn't weird. Here. The guy who spoke to your story. I spent $100 and I say. And I had bought 2 of these, because they were 99 cents, you don't have to go, and I bought everything, I bought the spinach, I bought the lettuce, you don't have to go.
Yeah. They were 2 for 1. Oh, no.
What?
No, I think 80 cents.
Oh, really?
Ice cream, 2 for 1. Gentle cheese, 2 for 1. I got you more sliced cheese because it was $3.99 a pint.
Wow.
Yogurt was, I got for half price. Cream cheese was half. Onions, buy one, get 1. Toasties, buy one, get 1. English muffins, save half. Spinach, buy one, get 1. Lettuce on sale. Tomato. Beer, save $5. David Hastings had COVID,
Again?
yeah, and now he gave it to Carol.